Bold claim: Obamacare subsidies were handed out to fake applicants with little to no documentation, raising serious questions about the integrity of the federal marketplace. A government watchdog report released on Wednesday reveals that roughly 90% of fictitious accounts tested over the last 2 years were approved for Affordable Care Act subsidies without the required materials to verify identity or eligibility. The GAO's initial findings from ongoing, covert testing of the ACA marketplace point to substantial fraud risks tied to the program's advance premium tax credit, the subsidy that Democrats recently attempted to extend for 3 more years before facing political hurdles. The GAO notes that the federal marketplace approved coverage for nearly all of its fake applicants in plan years 2024 and 2025, a pattern consistent with earlier testing from 2014 to 2016. In plan year 2024, all 4 of GAO's fake applicants obtained coverage with lower monthly premiums, driven by about $2,350 per month in subsidies paid to insurers, despite not submitting documentation to verify Social Security numbers, citizenship, or reported income. For plan year 2025, the number of fake enrollees rose to 20, with 18 remaining actively enrolled as of September 2025. The total subsidies for those 18 subscribers exceeded $10,000 per month. The GAO also uncovered evidence suggesting potential misuse of Social Security numbers, including cases where deceased individuals appeared to receive coverage or subsidies. For example, in plan year 2023, a single Social Security number supported subsidized coverage for more than 26,000 days, over 71 years, across more than 125 policies. In 2024, about 66,000 SSNs were linked to more than a year's worth of subsidized coverage. A comparison between deceased individuals' SSNs and tax credit recipients in 2023 identified more than 58,000 matches, including at least 7,000 people who had died before their coverage began. The report explains that the Centers for Medicare and Medicaid Services, which administers the federal marketplace, does not bar the reuse of an already used SSN for another enrollment, a policy intended to shield victims of identity theft but one that also enables potential misuse. Reaction from Republican lawmakers framed the findings as conclusive proof that Obamacare is broken and financially harmful to taxpayers. House Ways and Means Committee Chairman Jason Smith asserted that the GAO report is a smoking gun, showing how the current system funnels billions to insurers via identity fraud and drives up costs for all Americans. Other Republican leaders echoed the sentiment, arguing that Democratic policy choices have left the program vulnerable to fraud and affordability problems. The GAO investigation was requested by Smith and by Energy and Commerce Committee Chairman Brett Guthrie and Judiciary Committee Chairman Jim Jordan. As part of a broader political agreement to reopen the government, Senate Democrats are expected to take up a vote on extending the pandemic-era ACA tax credit, which is currently set to expire at year's end. Where does this leave the broader debate? If the system is prone to fraud and high costs, proponents will need to show concrete reforms that protect taxpayers while preserving access to affordable care. Critics will press for stronger verification, stricter fraud controls, and a more transparent discussion about how subsidies affect premiums nationwide. How should policymakers balance accountability with the goal of expanding health coverage for Americans who need it most?